What is an organ broker in organ trafficking bioethics? Have you ever wondered about the dark side of organ donation? Today, we will discuss a troubling aspect of this issue: organ brokers in organ trafficking bioethics. So, what exactly is an organ broker? An organ broker is a person or organization that acts as a middleman in the illegal trade of human organs. They facilitate the buying and selling of organs outside the legal and ethical frameworks that govern organ donation. In the world of organ trafficking, these brokers play a significant role. They often recruit donors, who are typically vulnerable or impoverished individuals. These brokers arrange medical screenings and coordinate transportation, connecting donors with recipients, sometimes across international borders. Their involvement is central to the operation of illegal organ markets, which take advantage of the global shortage of legally donated organs. From an ethical standpoint, the actions of organ brokers violate several key medical ethics principles. First, there is the principle of respect for autonomy. Ethical organ donation requires informed and voluntary consent from donors. However, organ brokers often deceive or coerce donors, who may not fully understand what they are agreeing to. This undermines the donor's autonomy and their right to make informed decisions about their bodies. Next, we have the principle of non-maleficence, which means do no harm. Organ brokers contribute to harm by facilitating surgeries that occur under unsafe or unregulated conditions. This puts donors at significant physical and psychological risk, which is a clear violation of this ethical principle. The principle of justice is also compromised in the illegal organ trade. This trade disproportionately targets poor and marginalized populations, worsening social inequalities. It violates the principle of fairness in healthcare access, as only those with money can afford to buy organs, leaving vulnerable individuals exploited. Finally, we consider the principle of beneficence, which aims to benefit patients in need without causing unjust harm to donors. Organ brokers prioritize profit over the well-being of both donors and recipients. This creates a conflict with the core values of medical practice. It is essential to differentiate organ brokers from legal tissue or body brokers. Legal brokers may handle cadaveric materials for research or training under regulated conditions. However, some body brokers have also engaged in unethical practices, blurring the lines between legal and illegal activities. Combating organ brokers requires a multifaceted approach. Strengthening legal frameworks is crucial, along with improving transparency in organ donation systems. International cooperation is also vital to address this global issue. Promoting ethical organ donation, practices that respect human dignity and rights, is essential. Healthcare professionals must advocate for ethical standards that protect vulnerable individuals from exploitation. By ensuring that organ transplantation is conducted fairly and safely, we can work towards a system that respects the rights and dignity of all involved.